Well, good morning. I just want to welcome the Executive Director of Environmental Health Trust, online at ehtrust.org. We're speaking with Theodora Scarato. She's joining us from Washington. I just wanted to first ask you, as far as what brought you to Environmental Health Trust?
Great. So I am a clinical social worker, and about a decade ago, I started learning about the research and began to dig in because I was highly skeptical, actually. But I'd worked with a lot of kids who had neurological problems from parents who had done drugs. And I'd done a lot of research in the area and was working with kids. So as I dug in and realized that there were impacts to children, to brain development, that just got me deeper in. And now I'm executive director and I work with scientists all over the world, actually. And I'm really honored to be working on this issue.
But specifically, when you're talking about, you came from the health side and the use of drugs or addiction. Environmental Health Trust is involved in the environment. So just to explain that a lot of the research and the work that you do comprises of, what's the scope of the work that you presently do with Environmental Health Trust?
Oh, so Environmental Health Trust is a scientific think tank, and we focus on prevention as the key in terms of human health and impacts to the environment. So although there's been years of working on plastics, chemicals, climate impacts, our current focus is really on cell phone and wireless 5G small cell infrastructure and the public health implications because of the large body of science that we already have that indicate serious risks from our increasing exposure. And exposure is increasing exponentially because of the densification of cell towers, all of these new wireless devices, Bluetooth, Wi-Fi, wireless cars, and so forth. It's becoming, unprecedented, actually. So our scientists are from all over the world, actually, and we coordinate programs, we put on scientific conferences, we publish research, and also educate policymakers and the public about our ultimate goal, which is meaningful change. We should have policy that protects people. Right now, the laws that we have in place seem to protect the industry more than public health.
What do you see as some of the implications of wireless technology? What has it been in the last 10 years? Where is it today? And where do you see it going in the coming decade?
Well, at the pace we're on, where we're going is not where I think we want to be, because when cell phones first came on the market, there wasn't pre-market safety testing. And there were cell towers put up without the kind of research you would expect, like even with drugs. If it were a drug, it would be illegal because all of the reports, the science that show effects such as impacts to reproduction, impacts to brain development, headaches, increased cancers, promotion of cancers if you already have cancer, and so forth. So what's happening now with 5G is that they're estimating, I think it's 800,000 new cell towers, small cell towers. They're called small cells, but there's nothing small about them. And that's going to be in neighborhoods, closer to homes than ever before. I mean, we've used to be that cell towers were on mountains and far away and they'd be miles away. Now they're putting antennas right in front of people's bedroom windows. And that means that the people living in the homes are getting much more radiation than before this, and you can't turn it off. We can turn off our cell phones and we can make changes in our home to reduce our exposure, but you can't turn off a cell tower antenna that's right outside your bedroom window. So it's involuntary exposure.
What are the present regulations that exist here in the US?
We have regulations that were set in 1996. And the FCC has the authority over them. They adopted limits based on industry groups' recommendations, not based on a federal agency looking at all the research, figuring out what is safe for people, what's safe for kids, what's safe for pregnant women. That was not done. In fact, it was intended to be done. The Environmental Protection Agency was tasked to do just that, set safety limits. And just as they were on the verge of developing those, they were fully defunded actually in 1996 when the Telecom Act was passed. Now, there's been no update and no change to those limits since 1996. And I should add that they're based on, and this is what got me, because I couldn't believe it myself, but they're based on a handful of small animal studies, a few in these studies where they heated the animals up with microwave radiation. They're short-term studies. They never looked at the groups that made these recommendations. They didn't look at long-term exposure to levels. They didn't look at how a child's brain might be impacted. And there's research now that we have that shows damage to brain cells and hyperactivity, memory loss.
Do our levels here in the US differ from those on a global, on a global level?
Well, that's a good question. So the levels, first of all, are increasing worldwide because of 5G deployment. However, the United States is one of the countries that allows the most radiation compared to other countries. Many countries, China, India, Russia, and some European countries have much more stringent allowable levels for cell tower radiation compared to the United States. They have what's called sensitive zones. So if you have homes or schools, nursery schools, hospitals, playground areas, there's even less radiation allowed in other countries. Whereas in the United States, it seems like the policy is just bring it on, open the door, open out the red carpet. Let's have these front yards be cell tower sites. So we are needing to catch up with the rest of the world and really do better. I mean, there's not a country that has the perfect regulations in place, but there are many countries that would not allow what we allow here in the United States. And that's because some of the countries actually have a framework of precaution. They believe that because we don't have the research, I mean, there's no way we could have what will be the effect of a cell tower over 30 years or 40 years. That research hasn't been done. So they have precautionary limits, and some countries don't even call them precaution. They are cautionary limits because the countries have determined, like Russia, that there is research showing nervous system damage, impacts. And India, the reason India changed its law, they went down to 10 less than they used to be. They're 10 times less than the top limits now, because they did research on the impacts to bees and birds. And there was such a wealth of information and studies that showed a variety of impacts that they made their limits even more protective. Not everyone's following their laws, I need to tell you, but they have them in place. Whereas in the United States, the Environmental Protection Agency last put out a report on what the levels were in 1986. And there is no regular monitoring. What's the levels? Whereas in Switzerland, in Germany, in over a dozen countries, they measure the radiation. The government measures it, makes it available. They have maps that you can click on your address and see what the levels are near your home. Whereas in the United States, we don't have access to that. Most people don't even know when a cell tower is coming. They don't, and then they want the radiation levels, and they get something that was done when the company first proposed. There's not real-time measuring.
What do you see any change or direction? Have you heard as a think tank about what may be coming per research, or is there anything that you've been able to do to kind of make a motion in that direction that we need more research today?
Absolutely. So we actually sued the federal government, the FCC, about their 1996 safety limits, because they made a decision a few years ago under Ajit Pai that there was no need to update their limits. So we have these 1996 limits, we have the deployment of 5G in all of these cell towers, and then they said, and by the way, we can just use those 1996 limits, no reason to even look at them. But they had a record of all kinds of impacts, people who've been injured, all of the science. In fact, it's tens of thousands of pages of scientific research. And we won in the federal court. And now the FCC has been mandated to re-examine the record before them. They were found to have improperly evaluated the research on children who are more vulnerable. They have developing brains that are more sensitive. They completely ignored the science on the environment, according to the judge's determination in the court order. And they ignored the way that we test and measure the radiation is completely outdated. We have test systems that are just antiquated. And that was another issue in our case. And also they didn't address the impacts to reproduction, sperm damage, as well as impacts to the brain. They have found to have ignored those. So the next step is the FCC needs to reevaluate, and we are calling for new limits that are developed by regulatory agencies with expertise in health and environment. And we also want limits that protect birds, bees, and trees.
When are those expected back?
Well, as is the case with court decisions such as these, they don't tell regulatory agencies when. Now, the FCC did not appeal to the Supreme Court, and we believe, good thing they didn't. There's no way we believe they ever would have won. I mean, it was pretty clear that they hadn't adequately reviewed the record, but it could take years. We're going to be on them. We did another filing in November, and we did a motion that they should, well, actually to the FCC, that they need to look at the latest science, because the way, this is really like the way courts work, and this could take years. The FCC could decide they're only going to look to the science up till 2019. We wanted to make it clear that we needed for them to look at the latest science. And since we won our case, there has been so much science published. I mean, it's nonstop, really. There's no lack of science. What we have is a lack of accountability at the federal level. We have an inadequate process for federal agencies to be looking at this. There was actually a mother in California that wrote to the FCC because a cell tower had been erected in her front yard. And the FCC lawyer wrote back and said, as long as the radiation levels are within FCC limits, it's been deemed safe by the FDA. So of course she wrote the FDA. And a lawyer from the FDA wrote back, the director of the Office of Policy for Devices of Radiological Health. And she said, we've reviewed your questions, but the Food and Drug Administration does not regulate cell towers or cell tower radiation. Therefore, the FDA has no studies or information on cell towers to provide in response to your questions. So if it's not the FDA, the FCC is not a health and safety agency. Exactly who, what is monitoring the science on cell tower radiation and 5G and ensuring the safety of people? So what I say is that sometimes the scandal is not what is illegal, but what is perfectly legal and has been for decades in this country. And that is that this issue has just been swept under the rug, ignored, and there's no there. There's just like the emperor wears no clothes. It's a house of cards. There is no safety, even though I will tell you that as a mother and as like I was shocked. I was like, wait, they can't do that. I mean, it must be safe. You can't sell it if it's not safe, right? even though I know about, food and all of this, it's not like but I just could not believe it, that this could actually be the situation, but in fact it is. And I'll tell you what, the Pittsburgh Law Review just did an article on this, and they said the FDA and FCC have failed in their obligation to prescribe safe radiofrequency radiation guidelines produced from wireless communication devices to protect public health and safety. So when experts look into this and you try to figure out what's going on, it's clear.
So I asked the question, from your perspective, from being a think tank, having regulatory or legislative on one side and science, and then you have the general public on this side, all looking at this issue of telecommunications and this oncoming onslaught of 5G infrastructure. What can we do? What can we do as a general public, would you recommend?
We need to elevate this issue. So it's really a two-pronged approach. We need to talk to your friends and family about this and just let people know, because most people don't know about it. Deal with some of the myths you might hear, like, oh, it's safe, the government says it's safe and so forth. But then the piece that I think is like the next step is talking to our elected officials, going to city council meetings, contacting your senators, representatives at the state and federal level, and letting them know about this issue and calling for accountability. Because even if you don't, even if you're sort of on the fence, like, well, I'm really not sure, I don't know who to believe, because you've got these scientists saying one thing, and these saying the others. The fact is, we need an independent investigation of the science to develop safety limits that are protected based on the current science. I mean, everyone can agree on that. Mm-hmm. So at Environmental Health Trust, we have a action tool, letter writing campaign. You can put in your email and it'll go to your elected officials. But better yet is to really, talk to them. And when they say their hands are tied, guess what? Their hands are not tied. There is something that our elected officials can do, which is ensure that there is science-based standards. So, they need to be based on current research, and it can't be industry-tied groups that are making these decisions, which unfortunately is what's been happening. And I don't know if you know about the Harvard Law Review article. Harvard pressed an investigation by Norm Alster, and it's called Captured Agency. And what he found is that the wireless industry is acting like big tobacco. And that's in terms of the capturing of our regulatory agencies, the FCC, which has former Verizon lawyers in its leadership, and then the money that is given to our members of Congress. And so this paper maps it out, excellent tool. It sort of helps you to understand how we could be in this situation. So Norm Alster, Captured Agency, how the Federal Communications Commission is captured by the industry it regulates. And
just in closing, go ahead.
I just want to say, some of the same scientists who worked on tobacco or work on pesticides and are defending products where there's science showing harm are also the same scientists who are defending the wireless industry across the country in various cases. So we have this problem of industry money in the science, and that this is a real challenge, and that's why we have a lot of work to do. But I fully believe that we will get there, especially because nobody wants a cell tower right near their bedroom window. Can I add just a few things, which is like some policy developments?
Please.
So one is that 600 cities in Italy, for example, have called for a halt to 5G before safety is assured. Many communities in Europe, in the United States, we have cities that are putting forward ordinances to keep those cell towers away from homes. In Ithaca, New York, they just passed a 250-foot setback from homes, as an example. In the state of New Hampshire, they're actually looking at a proposed law that would have a 1,640-foot setback for all wireless antennas. And that's because they had a 5G commission for a year. They met looking at the science. They had politicians, members, scientists, and doctors, and I think it was 19-member commission. And they made recommendations like reduce exposure, teach the public how to reduce exposure, keep the cell towers far away from the homes. And we need the federal government to set safety limits based on the latest science. We need limits to protect birds, bees, and trees, and so forth. You can go to Environmental Health Trust to read more, but there's so much happening. And so if you're just new to this issue, get involved, because there are people coming together all over working on this. And if just looking at New Hampshire, I mean, we can get there. We just need all hands on deck.
Well, thank you for joining us today. It's been a real pleasure. If you'd like more information, please, as you've said, ehtrust.org. But we want to thank you. Theodora Scarato joined us today from the Environmental Health Trust. She's the executive director with Environmental Health Trust. So we appreciate your input and look forward to some of these, to hopefully the general public becoming more aware. And certainly for your work as being a think tank is only going to help us kind of bridge that gap so we can maybe slow down this evolution of what is coming with the technology in our future. The last question I did have before I go, I did want to ask you about, and maybe just to, because the idea of what they're doing presently is with satellites. Is that part of what the Environmental Health Trust is also working on, meaning that, satellites being used as part of this whole infrastructure?
Well, there are a group of lawyers who are working on that as well, because the environmental issues have not, just like with deployment on the ground, deployment in the air has this different, but equally important environmental issues that are not being considered. It will increase radiation. It will also create trash. There's all kinds of space trash and all kinds of things. And really, we're just learning what it's going to mean, because it's all new and there's so many new satellites proposed. So we would think of that as part of the general increase that's happening, but that is a really important issue. One other thing I didn't mention was what businesses can do. Because as people become aware of this, we need to move forward. It's not that we don't want to move forward, it's that we want to do it safer. We want hardware and software changes that reduce exposure and that allow us to use technology without the radiation, like in more wired, landlines. I think about like things like phones that you can text on that are like our old landline phones, right? But you can text on them, so it's not like you're not getting those texts. So there's a lot of things that companies can do. They can design their networks in safer ways. They don't have to have them right in front of homes, and be partners in this, because ultimately, we have to connect, and we want to do it fast, and we want to have the capability to connect to the internet in a convenient way, but it does not have to be this way where we're not even looking at health and environment. So we actually have a whole list of things that companies can do to make technology safer. And some are looking at it, but we need more. And the public can help. We, the people who are the consumers, can request that.
Theodora, thank you so much for joining. Have a wonderful day and stay warm on the East Coast in Washington. So appreciate you joining us and look forward to speaking soon.
Thank you.
Thank you so much.